Human immunodeficiency virus is also known as HIV. HIV is known to be a retrovirus. A retrovirus means that the genetic material is RNA and not DNA. This virus is spread through body fluids that contain infected cells. These body fluids can be blood, seminal fluid, vaginal secretions, amniotic fluid, and breast milk. If there are a lot of infected cells in the body fluid, the chance of contracting HIV is more probable. HIV can also be spread in the utero from mother to baby, and as I said before, it can be spread through breast milk if you decide to breastfeed. This cannot be spread through casual contact. An example of this is if someone who has HIV touches a doorknob and someone who does not have HIV touches that same doorknob, HIV will not be spread. The chance of HIV being passed through the blood products, such as a unit of blood in an emergent situation, has been almost eliminated due to the voluntary self-deferral, completion of a detailed health history, extensive testing, heavy treatment of clotting factor concentrates, and more effective virus inactivation methods. Knowing you have HIV can be slightly difficult at times depending on if your HIV diagnosis is acute or chronic. Acute manifestations of HIV can occur within 2 to 4 weeks of exposure. These symptoms align very closely with that of the flu and can also include a rash and a sore throat. Some other symptoms include a fever, night sweats, chills, headaches, and muscle aches. The chronic stage of HIV can be known as asymptomatic, meaning that they can have this virus and not even know it. You can be this way for years. Even though you are asymptomatic, your body has produced anti-HIV antibodies. Over time, HIV begins to replicate and CD4 plus cells are destroyed, the viral load increases, and there is a significant loss of immunity that begins to happen. There are 4 different stages of the HIV infection. The first stage of the infection, your body will have an immune response that will then subside in viral set point. This is the balance between HIV levels in your body and the immune response. The higher the viral set point, the poorer the prognosis. This stage can last for years. This is also a part of the acute phase of the virus. For most people, this is also the asymptomatic stage where they do not know if they have HIV or not. The chronic stage of HIV is when the viral set point is reached. This means that the immune system cannot fight the virus anymore no matter how hard it tries. Your CD4 plus and T lymphocytes count is 500 cells or more. Stage 2 of HIV infection is also known as the symptomatic stage. This is where people start to have more symptoms of fatigue and illness due to the damage that is being done to the immune system. The CD4 plus and T lymphocyte count is 200 to 499 cells. Stage 3 of the HIV infection is when the CD4 plus and T lymphocyte count drops below 200 cells. The person now has a diagnosis of AIDS, which is acquired immune deficiency syndrome. This stage is known for the life-threatening opportunistic infections that arise. If AIDS is not treated, since this is the last stage of the infection, death is likely to occur within 5 years. Stage 4 has no information available at this time because it is still being researched. The HIV life cycle consists of 7 different stages. The first stage is when HIV binds to the receptors of the CD4 plus cell. After that, HIV and the CD4 plus cell membrane fuse together, allowing HIV to enter the cell. Next, once HIV is inside the cell, it releases an enzyme known as reverse transcriptase. This allows HIV RNA to transform into HIV DNA. Once HIV DNA is made, it is able to enter the nucleus of the CD4 plus cell. Once inside the nucleus, HIV then releases another enzyme known as integrase, which is when viral DNA is now integrated into the DNA of the CD4 plus cell. After that, replication starts to happen, and this is when HIV uses the mechanisms of the CD4 plus cell to create long protein chains of HIV. Once that is finished, assembly starts to happen, and this is when the new HIV proteins and the HIV RNA come together to create immature HIV. Once that is completed, the last step happens, which is budding. This is when the new formed immature cells of HIV release away from the CD4 plus cell. After that, another enzyme known as protease is released, which breaks off the long protein chains that now creates the new active mature HIV cell. You can test for HIV in many ways. The laboratory tests that can be performed are a complete blood count with differential and a platelet count. The CBC with differential will show abnormal levels that relate to anemia, thrombocytopenia, and leukopenia. The platelet count will be less than 150,000. Some of the diagnostic procedures include EIA, Western blot test, home blood test kits, and mucosal fluid or urine tests. EIA stands for enzyme immunoassay. This is a type of blood test or saliva test that can determine the presence of antibodies to HIV. This can also be known as enzyme-linked immunosorbent assay, or ELISA. The Western blot test is also a blood test that is used to confirm a positive test from another HIV antibody test. If the Western blot test comes back positive as well, then you should be tested for the HIV RNA quantification. This will test for the viral load of HIV before treatment is started. Home blood test kits are available as well that need to be registered anonymously. Some of the complications associated with HIV consist of bacterial diseases, HIV-associated malignancies, viral diseases, fungal diseases, as well as protozoal diseases. Some of the bacterial diseases consist of TB, bacterial pneumonia, and septicemia. Some of the HIV-associated malignancies consist of Kaposi sarcoma, which are purple-like lesions that are on your skin and on your body, Hodgkin's lymphoma, non-Hodgkin's lymphoma, invasive cell carcinoma, and squamous cell carcinoma. Some of the viral diseases consist of herpes simplex and herpes zoster. Some of the fungal diseases consist of Pneumocystis jirovecii pneumonia, candidiasis, cryptococcosis, and penicilliosis. And some of the protozoal diseases are PCP, toxoplasmosis, microsporidosis, and leishmaniasis. Some other complications that can come from having HIV include wasting syndrome, fluid electrolyte imbalance, and seizures, or HIV encephalopathy. Wasting syndrome is the involuntary loss of more than 10% of a person's body weight while having experiences of diarrhea or weakness and fever for more than 30 days. Fluid electrolyte imbalances go hand in hand with wasting syndrome. Since you can lose a lot of fluids from wasting syndrome, your electrolytes will be abnormal. HIV encephalopathy is characterized by progressive decline in cognitive, behavioral, and motor functions, which can then trigger seizures. Even though there is no cure to HIV, there are still a lot of ways that it can be treated to subside the long-term effects. The CD+4 count is the major predictor of disease progression and survival. The major route of treatment is antiretroviral therapy, which is also known as ART or ART. The goals of ART is to reduce HIV-associated morbidity and prolong the duration and quality of survival, restore and preserve immunologic function, suppress HIV viral load, and prevent HIV transmission. Some of the other ways to treat HIV is with medications that inhibit the process of the HIV RNA to release new enzymes to assist with the replication of HIV, like fusion inhibitors, entry inhibitors, protease inhibitors, reverse transcriptase inhibitors, and integrase inhibitors. Alternative methods can also be used, such as vitamins, herbal remedies, and shark cartilage. These can help stop the manifestations of HIV. It is important to let your provider know if you are taking these before prescription treatment occurs, because these may alter the effects.